Hello, I'm Eugene Kissen. I'm the program director for the fellowship program at Boston University Medical Center, and I'd like to welcome you to our center. Hopefully you'll like it and you'll rank us highly. I want to tell you why you should do so. So we have a really top tier program. We aim to produce fellows that can diagnose both rare diseases and know how to treat these patients based on their cultural background. One of the big strengths of our program are the patients that we see that come to us from all over the world, and we get to see them going from room to room rather than having to travel the world. We get to see all sorts of conditions and all sorts of backgrounds for our patients that really need our care. And that's what we do. We train our fellows to see and care for this patient group. Our patients come from around our hospital. We have a lot of indigent patients, as well as their family members that come to us from Albania, from Nigeria, from Haiti, from, like I said, all over the world. We also give our fellows an experience at the VA, which has its own demographic group. So our fellows are very well-rounded in that way. We also have a very strong research basis, and we have research in both clinical, translational, and basic science in the field of scleroderma, and have one of the best scleroderma centers in the country. As a fellow, you would work with our faculty and see lots and lots of scleroderma patients, as well as mimics of scleroderma through your years here. We have a top-tier clinical epidemiology program, and again, as a fellow, you would work directly with our faculty members and learn how to do clinical research, both didactically and by attending the research meetings, working hand in hand with our faculty to develop your own research program and get publications while you're here. We also have a top-tier ultrasound program, and it's something that I've developed over my career. You'll get a chance to work with me both in clinic and on Friday mornings. I will work with you specifically on ultrasound training so that you will know how to do musculoskeletal ultrasound by the time you're done. All of our fellows have gotten into the USONO program and finished it and done well with it, and I'm sure you will too if you get our help. So those are some of the highlights. We also do lots of interactive teaching with other divisions. We work with our pulmonary division. We have a multidisciplinary clinic with both dermatology and nephrology, which we've been having now for about a decade, and you'll have a chance to experience that as well. So again, welcome. You'll hear some more details from our other faculty members.
Hi, I'm Tahina Nioji, the Chief of Rheumatology at the Trevanian and Avedisian Boston University School of Medicine, Boston Medical Center. Thank you for your interest in our program. I'll start by sharing a bit about the history of rheumatology at our institution. Our section was established in 1960, and over the past 6 decades has had a proud history of training rheumatologists who practice across this country and, in fact, in several countries, bringing their strong clinical and research skills to benefit patients with rheumatic diseases all over the world. I am proud to be the 4th Chief of Rheumatology, having taken this position in 2019. Many of our faculty are national and international leaders in their respective fields of research and clinical expertise within rheumatology. Some highlights of the contributions to rheumatology made by our faculty include groundbreaking insights into amyloidosis. In fact, our institution continues to be an international leader in the diagnosis and management of amyloid. Scleroderma is another long-standing area of strength, both research and clinically, with our institution being New England's largest scleroderma program. Our section has run pivotal clinical trials in not only scleroderma, but also vasculitis, and most recently in the use of biologics in COVID-19. Our faculty are also recognized leaders internationally in spondyloarthritis, gout, and osteoarthritis, among other diseases. In fact, many of us have led or contributed to national treatment guidelines, such as from the American College of Rheumatology, and also led or contributed to classification criteria of various rheumatic diseases. And these are criteria that are used by regulatory agencies such as the FDA and EMA for drug approvals. So our trainees benefit from this immense clinical and research expertise. Other faculty in this virtual tour will give you more details, but I will highlight just one opportunity for which I am the principal investigator of an NIH-funded T32 grant, which provides funding for dedicated research training. Importantly, this grant provides the ability to obtain graduate-level coursework in areas such as epidemiology, biostatistics, or courses relevant for translational research through the School of Public Health or the Graduate Medical Sciences School. So our fellows who are interested in pursuing research training are able to avail themselves of this program. And in fact, our training program is so strong that virtually all of our fellows interested in pursuing a research career have been successful in obtaining research funding and launching their own successful research careers. Even for those not interested in pursuing a research career, we provide ample support to engage in meaningful scholarly activity during training, and you'll hear a little bit about the Fellow Research Training Committee to help guide fellows in doing meaningful and feasible projects. The section financially supports fellows in numerous ways for their scholarly activity, including the U.S. Sonar course that Dr. Kissen oversees, attending conferences, supporting abstract submissions, printing posters for conferences, manuscript publications, etc. Our goals for the future of our section include continuing to grow our pillars of strength, marrying our clinical and research expertise so that we can leverage our clinics to provide meaningful opportunities to gain more insights into rheumatic diseases that we manage to ultimately help improve the outcomes of our patients. We have been actively recruiting faculty to grow areas of dedicated expertise with 2 recent faculty we've hired, and in fact, you'll hear from one of them as she is a recent graduate. And finally, I just want to share that I myself moved to BU to seek out research training and have stayed here ever since. It's a fantastic program, fantastic group of faculty and staff to work with, and the opportunities I've had in my career to date have been unparalleled. One of the greatest joys and sources of satisfaction at work that I have is in helping others develop their own careers. I've been fortunate to be continuously funded for my research and have developed collaborations across the world. If you join our program, I'd be thrilled to help be part of your mentoring team for your research projects or generally provide career advice. I meet with all fellows individually several times per year, and I really look forward to helping be a part of each individual's career trajectory. So I look forward to meeting you during the interview season, and again, thank you for our interest in our program.
Hello, my name is Maureen Dubril. I'm a rheumatologist with a focus in spondyloarthritis, and I serve as Director for Research Training within the Rheumatology program. Thank you for your interest in our fellowship program. I wanted to discuss 2 highlights of the program, which include the research training as well as the VA clinic. Our goal at BMC Rheumatology is to help fellows become future leaders in rheumatology research or to become expert clinicians that are savvy consumers of medical literature, so that they can make well-informed decisions as to how medical literature should change their practice. To this end, we ask fellows to participate in at least one scholarly project during their fellowship time. This can include anything from a case report, a review article, all the way up to an original research project. To consider the options for this scholarly project, we ask each fellow to meet with our faculty and understand each faculty's clinical focus, as well as their research portfolio and projects that may be available to a fellow. With this input from our faculty, each fellow selects their leading projects and presents these to a research committee, who then provides some advice as far as completing a project that's most meaningful and feasible to complete during the time of fellowship. The fellow then works with their primary research mentor in order to develop milestones and to actually complete the project. And then we ask each fellow to present the results of their research at a scientific meeting, a local meeting, or anything, even including a national or international meeting like the ACR annual meeting. We have a couple of other approaches to research training, which include a series of lectures from our research faculty, as well as a series of journal clubs focused on study design, methodology, and biases. In regards to the VA clinic, it takes place at the Jamaica Plain VA, located just a couple miles from our main BMC campus. We have 3 core faculty preceptors, which include Dr. Karen Libby, Dr. Caroline Avazadeh, and myself. In the first year of fellowship, fellows attend this clinic when they're not on the BMC consult service, whereas in the second year of fellowship, this is truly a continuity clinic for our second year fellows, and they have their own patient panel. This is also a nice opportunity to learn community rheumatology and to learn and practice musculoskeletal ultrasound. If you have any questions about those 2 topics, I hope you'll get in touch with me.
Hi, welcome to BU section of Rheumatology. My name is Jean Liu. I am Assistant Professor of Medicine here, and my part will be talking about collaborative research efforts with a focus on spondyloarthritis. So first, a bit about me. I'm originally from Texas, and I did undergrad and medical school there. And then subsequently, I spent 6 years in the Pacific Northwest in residency at OHSU and rheumatology fellowship at UW, where I concurrently did a master's in epidemiology. And I landed here in July 2020 with my faculty appointment at BU. And my research is focused in clinical research with 3 areas of expertise. So axial spondyloarthritis, where I've looked at cardiovascular risk and outcomes, and more recently, chronic opioid use. Knee osteoarthritis, mentored by Dr. Miyoji, where I look at mineralization as a potential intervenable risk factor for OA, as well as identifying and studying early stage symptomatic OA. And finally, I've been involved in the COVID-19 Global Rheumatology Alliance, where we studied associations with poor outcomes among people with rheumatic disease and COVID-19, as well as early vaccination. So what do we mean by a collaborative research approach? For us, this is best exemplified by our weekly research accelerator meetings on Tuesday mornings. So a group of us, including all the clinical researchers, which include physical therapists, rheumatologists, biostatisticians, and epidemiologists, get together to ensure that all research products that come out of our group are as good as they can possibly be. So we review proposals for research, abstracts, manuscripts, talks, and grants, and all provide input in a very team-oriented manner. How would a fellow fit in with this research? So you would identify a potential project and hopefully identify potential mentors in plural who would work together to mentor you throughout the process. You'd be involved in a research team, which includes directly working with data analysts, and you'd have research meetings, and all of this would take you from the beginning of the project, where you have the idea and the research question, as well as the background literature review, through to the design of the study with a detailed research proposal, then the analysis and interpretation of the results, to presenting those results at the national meeting like ACR and publishing the results in a peer-reviewed journal. So some examples in the past few years of fellow-led spondyloarthritis research. So Sally is going to be faculty. She is a second-year fellow currently, and she's looked at fracture rates over the years in people experiencing spondylitis. Devin is a rising second-year fellow. She's looking at treatments for axial spondyloarthritis and their impact on fracture risk. And Bert is an incoming first-year fellow who's looked at opioid prescription rates over time in people with AS. So we do hope you will join us and you will consider doing clinical research in our collaborative teamwork-based approach, and that you also consider strongly doing it with us in spondyloarthritis.
Hi, I'm Dr. Lindstrom. I'm one of the junior faculty here at Boston University Medical Center. I get the honor of being able to talk to you about a multidisciplinary clinic and communication between the different departments. So most of the patients who come into rheumatology are going to be referred from their primary care doctor. We have a good network set up here in Boston where a lot of the community health clinics tend to refer straight to us. So we get relatively quick turnaround from them to be able to see a lot of the patients for their musculoskeletal or immunologic complaints. As you know, over time, rheumatology tends to be a very complicated specialty, and it's very common that we share patients between ourselves, dermatology, nephrology, pulmonology, just to name a couple. Here at Boston University Medical Center, we do have these fantastic clinics that are already set up that you can actually take part in. The first one that I'd like to talk about is the multi-D clinic for lupus. It tends to meet once or twice a month, and during that clinic, patients get to see 3 different providers at once. So it tends to be us in rheumatology, dermatology that's also involved, and then nephrology. So they're able to get 3 clinic appointments kind of for the price of 1. The good news about that department and the correlation between our departments is that means that it's easier for the patient, and it's easier for them to access other services through us as well. So there's a specific coordinator for that clinic, and it's easier to get patients enrolled in trials and to collect clinical data for patient outcomes. There's also a rheum derm clinic where the clinic itself is able to focus on all those diseases that tend to interact between our specialties, like scleroderma, cutaneous vasculitis is just to name a couple. It's pretty rare in rheumatology that we don't see at least one other provider who pops in throughout the course of the week. We share clinical space with dermatology. They're literally right down the hall. Pulmonology is just the floor above us, so it's easy to interact with them. And then renal also has at least a clinical day with us once a week. And there's usually a nephrology fellow who's there as well. We also have multidisciplinary conferences that happen throughout the course of the month. There's usually a monthly rheumatology, dermatology conference, room path conferences where people can bring up pathology results that they've seen and talk about some of the cases that have already come up. But we also have conferences between us and pulmonaries, so we can interact with them pretty meaningfully, especially since a lot of our diseases tend to have interactions with them as well, which isn't limited to just vasculitis or scleroderma. I mean, rheumatoid arthritis also has interstitial lung disease that's associated with it, and it can be helpful, especially if we have these cases where we're just not certain what the diagnosis is or what the primary disease driver is for those cases.
My name is Monica Crespo-Bosque, and I'm one of the clinical faculty in the rheumatology section. My interest is in lupus and also healthcare disparities. I would like to take the time to highlight the diversity of our program, as well as the experience you will be exposed to as a fellow at BU-BMC. I don't think I could talk about the program without first talking about our patients. Boston Medical Center serves as the safety net hospital for the city of Boston, and when it comes to subspecialty outpatient care for a large part of the state. As such, we serve a large inner city population, very ethnically diverse, largely underserved. Many of us chose to be at BU because of its mission to serve this population and hoping to help bridge some of the existing disparities and inequities within the system. As a fellow, you'll get to be exposed to the full spectrum of rheumatologic disease, and you will be seeing patients at all stages of disease. Some patients with very early on presentations to later on complications, as well as patients that are being sent to us for second, third opinions within an academic center. In terms of our faculty, we have about 20 faculty members, 7 of which are research focused and 13 clinical. We have a wide spectrum of areas of interest, including scleroderma, lupus, osteoarthritis, spondyloarthritis, crystalline arthritis. And the opportunities for our fellows are enriched by being exposed to faculty that are especially interested both clinically and within research in these areas. So you'll get to rotate in these subspecialty clinics to help strengthen your experience as you start to develop areas of interest for yourself. Additionally, there's a very robust ultrasound training program that's led by our program director, Dr. Kissin, with 4 of our faculty being ultrasound trained, and fellows have plenty of opportunity for supervised practice within the clinic and access to the ultrasound machines. When it comes to research opportunities, again, very strong support both for clinical research and training, as well for translational and basic science research, depending on the fellow's interest. So you learn a little bit more about the specifics with regard to research opportunities, but hopefully this will give you a sense of the broad range of opportunities within BU.
I'm Dr. Michael York, one of the clinical faculty at Boston University, and I'd like to talk to you today about the quality improvement projects that you work on with me if you're a fellow here, and also the lupus clinic, which I'm happy to work with Dr. Monica Crespo-Bosque is one of the rheumatology participants. So the quality improvement projects, each one of the fellows is involved in doing at some point a quality improvement project. And in general, we do this as a multidisciplinary team with physicians, nurses, the administration, MAs, and pharmacists. And we've had a lot of success. One of our former fellows won an ACR award, Nancy Desai at the American College of Rheumatology, for her project on HPV vaccination and cervical cancer screening in lupus patients who have a much higher risk of cervical dysplasia, even without immunosuppressive therapy. And the lupus clinic also won a quality improvement project in terms of lowering the no-show rate a couple of years ago, which was excellent. And in the lupus clinic itself, I work with Monica Crespo-Bosque as the rheumatology participants, and we have our colleagues in nephrology and dermatology alongside us one afternoon a week, where we see patients, usually very complicated lupus patients referred from other hospitals or very complicated from our own system. And working together, you get to see all the intricacies of medication interactions, which medications will work better for the skin disease, how to balance the medications and the toxicities. And in general, I've learned so much about lupus by just working with colleagues in different fields. And we're hoping to bring in further colleagues from behavioral health and also from obstetrics and gynecology to help. And so I think it's really been a unique experience to work alongside so closely with colleagues in different fields.
My name is Marcin Trojanowski. I'm the director of the scleroderma program here at BU. Since its founding by Dr. Joe Korn, this program is one of the biggest and best supported scleroderma programs in the region. Many greats in the scleroderma field got their start here through BU. And we look forward to teaching the next great scleroderma scientists here at this program. I think we'll offer unparalleled clinical training in the evaluation of a scleroderma patient, from the ability to do a modified rounded skin score with ease, as well as nail-fold capillaroscopy using multiple tools, from a handheld rheumatoscope to our in-house video capillaroscopy device. We also offer the opportunities to do clinical trial training with the various clinical trials that we perform in the division on this devastating disease. The program will also, for those interested, offer the opportunity to do translational research in the field of scleroderma, as we are supported by one of the biggest fibrosis and scleroderma specific laboratories in the country. Several of our fellows have taken advantage of this in recent years and are presenting their topics at the ACR. This will be explained more by my colleague, Dr. Anda Bajour, who is coming up after me in the video session. Also, finally, we offer multiple multidisciplinary opportunities here. We have a joint clinic with dermatology, where you learn, for those interested, the intricacies of wound care and scleroderma skin-specific treatments, particularly in localized scleroderma variants. As well as our virtual clinic, which we do with pulmonary, that is culminating with a multidisciplinary meeting. For those interested, feel free to reach out to us, and we'll be happy to answer any questions. Thank you.
Hello everyone, and thank you for your interest in our fellowship program. One of the learning opportunities that we offer our first-year fellows is a continuity. Every Friday morning, we will see together a panel of patients that will be coming on. Fellows see an average of 2 new and 4 return patients on their clinic day. You will be responsible for the longitudinal care of these patients throughout the first year of your fellowship. This will give you the opportunity to have extended follow up with your patients, which is important in rheumatology because most of our patients have chronic illness. As a supervising attending for the Fellows Clinic, I'm going to provide you with oversight and guidance through this process. We will discuss together each individual case and focus on the critical elements of the history that will help you formulate a pertinent differential diagnosis. You will also become familiar with the appropriate testing and management strategies. Next, I would like to give you a brief overview of our translational research opportunities here at BU-BMC. Our investigators are doing cutting-edge research in scleroderma, gout, and osteoarthritis. We have a large biorepository of clinical data and samples from scleroderma patients that is continuously growing and helping us investigate disease mechanisms and biomarkers. We have a nail fold video capillaroscopy system and a novel optics device that we are currently testing in scleroderma. I'm doing this with one of our first-year fellows, Dr. Han. Previous and current fellows have also been involved in projects looking at the role of macrophage interactions with endothelial cells and fibroblasts in scleroderma, and there are other research projects currently underway, including looking at biomarkers in osteoarthritis and gout. I can confidently say that our program offers a wide range of very interesting research for our fellows, with plenty of opportunities to start and develop their own academic careers. I am looking forward to the opportunities to spend time learning together should you match to our excellent program.
Hello, my name is Natalia Sromachevska. I'm one of the newer clinical faculty here at the Division of Rheumatology at Boston University, Boston Medical Center. I previously finished my fellowship training at Beth Israel Deaconess Medical Center here in Boston and my internal medicine residency training at the University of Massachusetts in Worcester. I'm currently a full-time attending in the clinic, seeing patients and building my patient base. In my clinical time here at BMC, I have noticed the incredible pharmacy staff who are embedded in our clinic and greatly help improve our patient care. They perform our prior authorizations and set up our infusions and infusion orders, which is extremely helpful and takes a lot of burden off of the clinicians. We also have wonderful administrative staff and medical assistants who help the clinic run smoothly. We have nursing staff who do medication teaching, administer immunizations, and help triage patient messages and patient calls through Epic. We also have exceptional interpreter services available. They're quick and easily accessible, and they help us take care of our diverse patient population. The clinic is also equipped with several ultrasound machines, which are used frequently by several of the attendings here in clinic. There's also a portable ultrasound machine, which is used on the inpatient consult service. This makes inpatient bedside ultrasound teaching also a helpful aspect of the program here at BU-BMC. Overall, I have felt very welcome and very happy in my time here as a new clinical faculty and feel that it's a wonderful place to work. And I hope you join us.
Hello everyone, my name is Sally Marjana. I am one of the clinical faculty members in the rheumatology department. My main clinical interests are spondyloarthritis and musculoskeletal ultrasound. I would like to take this opportunity to share a bit with you about my fellowship experience at BMC and my transition into a clinical faculty here. So first of all, I chose BMC for my fellowship training initially and for my clinical practice later because of its big mission to serve the underserved. As the largest safety net hospital in Boston, BMC cares for a diverse inner-city population. It's something that we take great pride in. And in addition, it gives us also a big exposure to a wide variety of diseases across every single aspect of rheumatology. During my fellowship, I really believe that BMC offered everything it was looking for, including excellent mentorship, both clinically and in research, highly supportive faculty, and a collegial environment. Clinically, they mentor you closely to ensure that you become a great clinician. You will be taught the very, very basics in the beginning, and then you will be guided step by step as you grow into an independent clinician. On the research side, there is a strong effort to connect you with mentors whose interests align with yours. I remember toward the end of my fellowship, they helped me fill any gaps that I had left whether it's exposure to complex cases or gaining more experience within ultrasound-guided procedures. At the same time, I was given increasing autonomy in patients' care to ensure I feel confident about practicing independently. The program also does a great job supporting fellows as they transition into either academic roles or private practices. Now, as a faculty member, one of the strengths of our department is the wide spectrum of clinical expertise. We have a faculty with diverse interests, including ultrasound, lupus, scleroderma, myositis, vasculitis, and spondyloarthritis. This allows you to learn from different perspectives and develop your own niche. We are especially proud of our ultrasound training program, which is one of the strongest in the country, and you probably have heard a lot about it already by Dr. Kissen. We also care for a large scleroderma population and have a diverse multidisciplinary lupus clinic, which you've also probably heard about from Dr. Crespo, Dr. Bujur, Dr. Trojanowski, and Dr. York. Equally important, the junior faculty, including me, receive strong mentorship and support to build their careers. Since starting, I have had great support in developing my patient panel while I'm continuing my research and contributing to the education of fellows, residents, and medical students. One of the things that I value most about our department is our weekly Wednesday meetings. I love those meetings. We come together every week, we discuss challenging cases, we share management approaches, we attend grand rounds, we have speakers from all over the country. We talk through curriculums updates, we exchange research ideas, and not only that, we also celebrate each other's personal achievements and life events. It really reinforces this sense of community within the department. I'm very much looking forward to meeting many of you during the interview season. And if you have any questions about BMC or rheumatology in general, don't hesitate to reach out to me. Thank you.
Hi, my name is Bakhtir Manji. I'm one of the newer clinical faculty in the Boston University Medical Center section of rheumatology. I also recently graduated from this fellowship program, and I would like to share my recent experience, especially from the perspective of an international medical graduate. My connection with this program started when I came here for an away elective during residency. And what stood out to me right away was how supportive everyone was. I felt genuinely welcomed. And that experience played a big role in my decision to return here for fellowship. During fellowship, I received a very strong and comprehensive training, and I was surrounded by mentors who were really approachable and truly invested in my growth. It wasn't just about learning the clinical, research, and education aspects of rheumatology. It was also about building a long-term career path. As an IMG on J1 visa during my training, I recall that career planning felt very complex and even overwhelming at times. And what was really critical for me was how supportive was everyone in the program throughout this process. They encouraged me to explore J1 waiver opportunities here and at other institutions. And in the end, I ended up staying here as a clinical faculty, which I'm very happy about it. And I really appreciated their support every step of the way to help me navigate challenges in a structured manner. Their support really allowed me to stay focused on my training and my goals as I was slowly transitioning from the final year of fellowship to an attending life. I also see that every day that this kind of support continues here for our current fellows. It's really a consistent part of the program's culture. Now, as a junior faculty who recently navigated these challenges myself with an IMG perspective, I really value being able to part of this culture and just give back. This is a program where you feel supported not only during your training, but also as you start thinking about your long-term career plans after fellowship. I hope you get to explore our program more. Thank you.